another event, another evening event here on Mermaid Beach, and today's event is about male benign prostatic hyperplasia, otherwise known as enlarged prostate. So we're going to be looking at how the new treatments fare up for this, which is a common problem faced with lots of men in the population, and it's going to take place in the Little Truffle restaurant just across the road, and I better go because I'm running late. See you soon. Hi there, welcome to Dr. Nora. So I just came back from a free educational evening seminar event in Mermaid Beach, and this was about men's health, primarily focusing on the management and treatment of benign prostatic hyperplasia. Now, in layman's terms, this means the treatment or the management of men who suffer from enlarged prostates. And did you know that over 600,000 men in Australia are affected with problems with their prostate? And also approximately 30% of men over the age of 50 have moderate to severe problems with their urinary system. The symptoms you should look out for is any change or difficulty in passing water. Now that can be categorised as problems holding your water. So for example, you feel that you need to go to the toilet a lot more frequently, or it may also be categorised as when you pass the water. And those can be symptoms such as having trouble getting the stream going, having trouble maintaining a steady stream, and you may even experience some bleeding or some blood loss in the urine stream as well. These are all very important symptoms and signs that you need to look out for and see your general practitioner or your doctor as soon as you notice them. Other sorts of symptoms that patients can also complain of are things like dribbling after going to the toilet. So for example, they feel like they haven't completely emptied their bladder and there is a little bit of an accident at the end. Although some of these can be quite embarrassing to talk about, I urge patients not to be embarrassed or shy away from such problems, as the quicker we manage your symptoms, the better their outcome is. And we want to prevent anything like any long-term bladder problems, which can happen if you don't seek any medical help sooner. You may expect to have a blood test from the doctor. You may also expect to have an internal examination, which is where one gloved, lubricated finger is inserted into the back passage to have a feel of the prostate to assess if it's enlarged or if there are any suspicious nodules on the prostate. It is very important that as a patient you present to your doctor early on to get some treatment, and that treatment generally tends to be medication. Now this medication can be started as soon as you have prostate symptoms, or if you need to be referred to a urologist, which is a specialist in the men's health, this may be initiated with them. Further down the line, if treatment is not successful, patients may be referred for surgical treatment. It's really important as a general practitioner, and indeed the main takeaway point from this event today, is that we want to prevent any long-term bladder problems. And the way to do that is by raising awareness in the general population and making sure that if men do suffer from any urinary problems, to come and see their doctor as soon as they can. Of course, as we all know, prevention is better than cure, and I do urge you, if you do have any prostate symptoms or you're concerned about any urinary symptoms, please be aware that it is a very common problem in the aging population, and that your GP can help you, guide you and assist you through this. So for all you medical students out there, here are some fun tidbits about the event itself. The event was held in a nice restaurant on Mermaid Beach. The environment itself was very informal, very relaxed, and everybody was really friendly and chatty. The demographics of the event, well, being a men's health event, you would naturally assume that there'll be more men than female. And in fact that was true. There were only 3 females out of about 40 men, so it's quite an interesting population. That being said, I think having a broad knowledge of all aspects of medicine is really important, even if you don't have an interest in men's health. So as a female doctor, I found it really useful to attend this event just to keep up with your clinical knowledge, because you will see patients from all backgrounds in your general practice. So it's important, even if you don't have a specialist interest in men's health, to attend as many conferences, as many events as you possibly can. After all, it is free, so I do thoroughly recommend keeping up with your clinical guidance and gaining as much knowledge as you possibly can. Good luck with all of your studies, and I hope to see you on the other side very soon. So I'm really happy that I went to this event today. It's raised a lot of awareness, and hopefully I've managed to raise awareness to yourselves today. Of course, if there are any concerns, I'll be happy to see you in my clinic, Dr. Nora. And of course, as always, Take care and stay healthy.